So good afternoon and welcome to our webinar. We are so pleased to be bringing you our TAVR patient panel this afternoon, and it will be moderated by Lindsey Rammrath, and I'm going to introduce her in just a moment. Next slide, please. Just a few things to remember about today's webinar. All attendees are in listen-only mode, but we do want you to ask questions and be engaged. So we ask that you type all your questions into the Q&A box, and there will be time at the end to answer those questions. Please note that questions about your specific condition or treatment cannot be answered on this webinar, but we encourage you to go back to your healthcare team and ask those questions. This webinar is being recorded and will be available on our YouTube channel probably by tomorrow or Monday at the latest. And now I would like to introduce Lindsey, who has graciously agreed to moderate this panel for us. Lindsey's been a nurse for 10 years and has spent her entire career at Houston Methodist West. She began her career on the medical surgical floor, focusing on cardiovascular services. After 3 years, Lindsey transitioned to the cardiac cath lab, and in 2019 started the hospital's first structural heart coordinator program. She currently runs that valve clinic and oversees the ever-growing structural heart program. This summer, Lindsey completed her master's in nursing administration, so congratulations, Lindsey. And when not working, she loves spending time with her family. She's got 2 kiddos who are 5 and 2, and she also volunteers for the Houston Livestock Show and Rodeo to raise money for education and the youth of Texas. And Lindsey works really well with our Sugar Land, Texas chapter and has been so helpful to our organization in many ways. Next slide, please. We would also like to thank Edwards Life Sciences for the educational grant that is allowing us to put on this program today. Next slide, please. And finally, if you are not yet a member of Mended Hearts, Young Mended Hearts, or Mended Little Hearts, please go to mendedhearts.org. Our memberships start at $0, so anyone is welcome to join. And now we're going to close up our slideshow, and I'm going to turn things over to Lindsey, who will introduce our speakers.
Good afternoon, y'all. I'm going to start with Mike Brown.
Hello.
And if you could tell us about yourself, Mike.
Yeah, I'm from the Woodlands, Texas, originally from Alabama. I had a heart attack in 2014, I think it was, and a bypass soon thereafter. And I had a TAVR about 2 years ago.
And then Chip, can you tell us about yourself?
Yeah, my name's Chip Hassan. I'm in San Juan Capistrano, California. Short version of my cardiac history is a bypass when I was 50 years old, about 21 years ago. A couple stents over the years, and then TAVR 6 years ago.
Oh, and Mark?
I'm sorry?
Mark, are you
Yes.
part of the...
Yes, I'm here.
Okay,
For some reason I can't start the video. It says the host has stopped it, but
You should be able to now, Mark. Please try again. Thank you. Bottom left-hand side. There we go.
okay. Thank you. I'm here. I had open heart surgery for aortic root and aortic valve replacement about 16 years ago, and had a TAVR about 5 years ago when I developed some stenosis in the new aortic valve.
Perfect. Thank y'all for introducing yourselves. I'm going to start. We've got about 6 questions to go through, and so I'll have each one of you answer the questions for how your procedure went, or how the process went for you. The first question, I'll start with Chip. Can you share what type of symptoms you were experienced before having your TAVR, and how did you feel before the procedure?
Who are you asking?
You can start, Mike, if you would like.
Oh, Well, when I went into the hospital to get my TAVR, I had to stop halfway to catch my breath. But when I came out, the day after I came out, which was like 2 days later, I went to cardiac rehab and did 2.5 hours of exercise without any problems at all. So that I felt a lot better after.
Mark, how would you say that your symptoms were before your TAVR?
Actually, I didn't really have any symptoms. I went to the cardiologist for a normal visit, and he said, I think, you should see the guy, the surgeon across the hall. And I went to him, and he actually was sort of pushing me towards having a second open heart surgery. And I said, I didn't like it much the first time. I'm not having another one. And I went to see a second specialist in TAVR here in Brooklyn. And he said, yeah, you can have it. He said, but how are you walking around? Your aortic valve is like the diameter of a pencil. And I said, I don't know. I guess I'm very stubborn. Anyway, I went into the hospital. I had the TAVR. It wasn't like very quickly. It was maybe a week later or so. I had pretty much gone through everything that was going to happen to me at the hospital, including a tour of the recovery floor and then the regular floor, everything, including where to go physically when I entered the hospital at 5:30 in the morning. And I entered at 5:30 on a Wednesday. I walked out the door on Friday at about noon. I was up and about walking around the floor. On the day after I had the TAVR, I was walking pretty much more quickly than the nurses were. I felt fine. Once they took this venous line out of my neck, that I needed that, then I felt fine.
And Chip, how were your symptoms before your TAVR?
Well, mine were a long time coming. They picked up the fact that there was a fair amount of stenosis and it was just slowly degrading. And it just got to a point where the strategy we had, because of my age and overall health was good, I really didn't qualify for TAVR under the FDA guidelines at the time. And speaking of Edwards, I happened to have a really good friend whose niece was the TAVR rep for Southern California, who knew Raj Makar real well. And she got me in to see Dr. Makar. He was looking for a younger guy that who would really beat one up pretty hard. That was me. And so within about a week, it was done. The procedure, from a patient standpoint, I mean, I'm sure if you were watching it, I'm sure it's pretty hairy and it's pretty complicated and complex. From a patient standpoint, I'd like you, Mike, or Mark, I've been opened up and I did everything I could to make sure that would never happen again. And it was an absolute walk in the park. When I was leaving, I do a lot of road cycling, and the only thing Makar told me was, I don't want you on a bike seat for about 10 days because of the incision. He said, after that, go do whatever you want. And that was 6 years ago, and I've been doing whatever I want since. So I'm a big TAVR fan.
And that kind of leads into the second question, which is, why did you choose TAVR rather than having open heart surgery? Chip and Mark, it sounds like y'all weren't going through open heart surgery again. Mike, how about yourself?
Well, I had the bypass. I guess that's open heart surgery, but
Yep.
The TAVR was real easy. I mean, it wasn't anything at all, actually. I mean, it was like 2 days in the hospital, and I was out the next day doing exercises.
Yeah.
So it was real good.
And then Mark, the next question, we'll start with you. What kind of advice would you give to people who were thinking about getting a TAVR?
I think I would advise them to, one, speak to the surgeon who's going to do it, and so that they feel comfortable with it. I was afraid that this first surgeon was going to say, we'll do a TAVR, and that he would do a bait and switch, and I would wake up, having had my chest ripped open a second time. The other thing that I did, which was very helpful for me, was there was a TAVR coordinator at Maimonides Hospital here in Brooklyn. I went to her with a bunch of questions specifically about everything that I was going to experience. And she answered all the questions. She took me on a tour of the hospital, really, to show me where I would go. And she introduced me to the nurse who was in charge of the recovery from TAVR, and the nurse on the floor I would go to the next day. So basically, I knew exactly what to expect. She said, the only thing I can't show you is the operating room, but I can take you near the operating room. This is where you're going to go. And I walked in, I was very, very comfortable. So my advice is to ask questions of the people. So just that when you go in, you do feel comfortable about the procedure.
Chip, what kind of advice would you give somebody that is thinking about getting a TAVR?
Run, don't walk. I mean, I would echo exactly what Mark and Mike said. It's from a patient standpoint, it's almost a non-event. There's literally no recovery. As I understand it, the lifespan of a TAVR valve, they expect by the time all the dust settles and the data's in to be about the same as a biologic valve. As a bypass person like Mike, I got through it like everyone else, and your brain just kind of puts it behind you, and you don't really think about it. But then when the prospect of having to get opened up became real again, I just wigged out. I just put my heels in the sand and said, that's not happening. I don't know what's going to happen, but that's not happening. And fortunately, things worked out. And like both Mark and Mike have said, the procedure itself is just it's a big stent. I mean, from the recipient, think of it as a stent procedure, because it's not a whole lot different than that as the recipient. Obviously, on the other end, it's a lot more complicated, but as a recipient, not much different.
Yeah, I would say, the other thing is that it does pay to go to a hospital where they do a lot of TAVRs, and they've done a lot of TAVRs, because that gives you some confidence that they actually know what they're doing. They won't be sort of fiddling around inside you, figuring out as they go along.
Mike, do you have any advice that you would have?
Well, when I went in, they let me go into the operating suite. I mean, not in it, but to a window, so I could see what it looked like. And they answered a lot of questions. So I was very confident that it was going to be okay. Because the surgeon that I had, he had done over 800 TAVRs, he said. I don't know if he's bragging or not, but that's what he said.
And then we'll start with you with Mark, this question. Can you talk about the process you went through leading up to your TAVR procedure?
To whom? For whom is that question?
Hey, Lindsey?
You can go ahead, Mark.
Oh, I don't know about the process. I just, I went to the cardiologist one day. Really, it was a normal visit. And he just said, I think there's something wrong there, and I trusted the cardiologist. He'd been my cardiologist for a while. So I just went and did it. And I think it was about 2 or 3 weeks later that I had the TAVR done.
Did you have to make multiple trips to the hospital for additional testing and such?
I made one trip to I made 2 trips to NYU. That was when I saw the cardiologist, and then I had to go back about a week later so I could get to see their TAVR person. And then when I got home, since I had this thought in the back of my mind that the surgeon might do a bait and switch, I called up my first heart surgeon, who was no longer in New York. He was now in Texas. And I said, you said that there was somebody doing them in Brooklyn. And he said, yes. I said, where? He told me the name. I went to see them. I made the appointment. I went to Maimonides Hospital, and then I came back home, called up my old surgeon, and I said, if you had a choice between NYU and Maimonides, which one would you go to? And he said Maimonides. No, no doubt about it, no hesitation. I mean, he's a friend of mine, so we did speak. I think I'm the only person who's had open heart surgery where the heart surgeon became my healthcare proxy. So I trust him, and then, as I say, I went to the hospital. I went through the interview with the TAVR coordinator. The surgeon spoke with me for like a half hour. The cardiologist in the program came in and spoke to me as soon as he was free. And the surgeon came back in and spoke, all the four of us, the cardiologist, the cardiac surgeon, the cardiologist, the TAVR coordinator, and I, we were all speaking for 15 minutes or so. I felt very comfortable when I decided I'm having the surgery. And it was, you're very right about, Chip, about from the patient's point of view, it's nothing. I mean, the only surprise that I had was that they shaved me so thoroughly. The only body was on my head.
Chip, can you tell us about the process you went through before getting your TAVR?
Well, I live in San Juan Capistrano, California, which is South Orange County. And the guy who wanted to do mine was Dr. Raj Makar out of Cedars-Sinai. And that's a long drive, and with traffic, it's longer. So there was actually 2 visits. The first visit was an all day of assessment, imaging, and to make sure that, that I, in fact, was a candidate for a reasonable risk candidate for TAVR. So you're going to spend about a day doing that. And then after that, the schedules, was scheduled. Makar at the time was leading the Galileo studies, and he had done, my cardiologist, who he could not get me qualified, had done about 80. This is 6 years ago, which is an okay number at the time. And I found out that when I went up to Cedars-Sinai, Makar had done over 5,000. And I'm sorry, I'm just going to go with a guy who's done 5,000. He's seen every hiccup there is. There's not a lot new going to go on. And it went like everybody else, Mike and Mark, it just went without a hitch.
Can you go through your process before your procedure with us?
I'm sorry, didn't understand that.
Mike, can you go through the process that you went through before your TAVR?
Well, the first, about a week before, they sent me in to do a transesophageal ultrasound to make sure that the hole, the aortic valve was big enough for the valve they were going to put in. So that was rougher than the actual procedure because they stuck a tube down your throat, and they didn't have me out all the way when they put it in. So I gagged a lot. I didn't like that. But the actual procedure was quite easy. I went in, they put me out. They talked to you quite a bit beforehand to ask you questions and make sure that you didn't take what medicine they told you not to take. And then they put you in, you're out. And I don't know how long it took because I was out, but when I came out, I felt really well because my ejection fraction was almost, had gone way up. I think it's 35 or 36% now, or something like that. Before it was real low. I don't remember what it was before. And when your ejection fraction goes up like that, it makes you feel a lot better. So my procedure was real easy.
The one thing that I do remember now is, and I had to tell them was, and I don't know if the procedures changed at all because it's been almost 7 years, I guess, but they wanted you to lay flat in bed, for, I want to say, up to 8 hours. And that, for me, I'm a hyper guy. And I just told them, I said, that's not going to happen. I said, you guys are going to need to knock me down. And they did. they did it pretty maybe. I just sat there and drooled a lot and watched the TV for about 8 hours. but that's what needed to be done. And that's how they did it. The other thing, and I don't know if this is still, again, because I'm away from this stuff for a lot of years, they were pretty upfront about saying, because I guess it's SI node. I guess when the TAVR deploys, it's pretty violent and it can do some damage. And they said that there was probably about a 10% chance that as a TAVR recipient, you may wind up with a pacer. And I really didn't want that, but was willing to take that risk. As it turned out, everything was fine. So I don't know, Lindsey, is that still an issue?
It's still an issue, but I think the rate's down to somewhere between like 6 to 8%.
Okay.
And then we, at our facility, bed rest is actually closer to 4 to 6 hours. So the technology is advanced on that too.
Yeah. It's like everything else gets better. And it's not like a pacer's at the end of the world either. It's just I just didn't want to deal with it if I didn't have to.
So the next question, y'all have all kind of answered what the recovery process was like after the procedure, but is there anything that you would want to add to what recovery process was like, Mike?
Well, after my procedure, they said you had to lay down, flat for like 4 or 5 hours. I don't think it was 8. I don't remember exactly. And then the next day I was out and I was able to go to cardiac rehab the day after that. So it was real. I mean, that part was fine. It was really good. So, yeah.
Mark, would you like to add anything?
With me, I know that I had a venous line in my neck, and that my hands had like big furry mittens on them so that I couldn't play with the venous line. I do remember being really annoyed with one nurse who I couldn't speak and I couldn't really do anything. And I was trying to tell her that I had pain from the tube in my throat. And I'm motioning my hands and she's thinking that I'm like a little hysterical. I don't know, but I was awake. I just couldn't open my eyes from the sedation. And so eventually she woke up and she said, "Are you having pain?" And I nodded my head vigorously, and they gave me an injection of something or other. So I don't think anyone told me that I had to lay flat on the bed. I just was incapable of doing anything but that. So there was no choice involved on my side. It just happened, But then they took out the venous tube. Actually, I was waking up. My eyes were finally responding to my brain, and the eyes opened up and people came in and I could sort of, motion and everything. And when they took the venous tube out, I could speak. They took out the tube, excuse my throat. And then the next morning they took out the venous tube. That was the only thing. It was uncomfortable having it there. It's not so much uncomfortable. It was just, I wanted it out. And the surgeon promised it would be out at 6 o'clock in the morning. And I bothered the nurse immediately at 6 o'clock and said, "Where is the surgeon? You promised it out at 6 o'clock. I want it out." And he came. 6:30, it was out.
Chip, do you have anything you would like to add?
No, not really. I mean, everything I would do, just echo what Mark and Mike have said. I mean, people who are listening to this are probably thinking we're paid by Edwards to downplay this, but the fact of the matter is, it just was that easy, that smooth, that uncomplicated, and literally close to zero recovery. I mean, stack that up with someone who's been cracked open sometime and see how they compare the two.
Yeah, I mean, even with a slight mix-up with the venous tube and the taking out the intubation tube, it was nothing at all compared to open heart surgery.
Yeah.
I mean, I was a happy camper the morning. By 6:30 in the morning, when the tube came out, I was absolutely fine. It took me 5 days after open heart surgery to get to that point. So you're right. We sound like shills for the company.
Hey, Laura, one thing that I was talking to Laura Thorpe, who's the Edwards rep in Southern California, and I happened to see her because it's a long story, but she was saying that Edwards is now playing with some second generation or third generation valves that they think are actually going to last longer. It has something to do with the tissues coated with something or something like that. I think right now, the word that I'm hearing is that they expect TAVR valves to last about the same as a biological valve. And when that wears out, they TAVR. I mean, I asked Makar what happens when this wears out because I wasn't that old. He goes, no, we TAVR, we're doing it now. So what are you hearing in terms of longevity?
So we're hearing about 10 years, but the data is still out, and that new Edwards valve, their research is just now coming out on that. So I think they don't necessarily have all of the numbers yet. So I don't want to speak for that. I'm not well versed in the new data, I guess I should say. But yes, they are on like their third generation Edwards valve now. And then they did add a protective coating to the leaflets, it's making it just like the bioprosthetic surgical valve.
And I did check in the meantime. I looked at my paper, and Chip, you and I are both 6 years into the TAVR.
Cool. Yeah.
I'm looking I want it to last, at least 10 years, maybe a little longer.
Well, the last checkup I had, my cardiologist, I have to do it was every 6 months or 1 year. And it's been basically 6 years in this past October 1st or something like that. But he was picking up, we have to do an annual ultrasound, and he's picking up no stenosis yet. So on that valve. So far, so good.
Yeah.
So the last question I have for y'all, what advice would you give to someone who has to make a decision regarding their health care regardless of their heart condition? Mike, do you want to start?
Could you repeat that? It kind of broke up.
Sure.
Yeah.
What advice would you give to someone who has to make a decision regarding their health care regardless of their heart condition?
First thing is listen to your doctor and ask them questions, as many as you can, as many as you can think of. And if they give you a choice between a TAVR or open heart surgery, I would go with the TAVR, but that's your decision. You have to make it yourself, but it's the easiest way. The open heart surgery it's not fun. I had that one, I had to bypass, and boy, it was not fun at all.
Yeah.
So that's my advice.
One of the things that I did was the first visit to Makar, where we were trying to figure out whether or not I could qualify or not. I took my best friend with me, who's a really smart guy, and that was one of the better things I did, because your mind's a mess. If your spouse goes with you, her mind's a mess, and things are going in one ear and going out the other ear, and you're in a tough spot in life. And having his name is Mike, and having him there made all the difference in the world, because he could stay focused. He could just stay on point, as far as asking questions and getting information. And so I would really advocate taking someone there who has some distance, from you, not a spouse, not a necessarily direct relative, but someone who's just more objective and can sit there in those meetings and take notes and ask good questions that you're probably not in a state of mind to do. So that would be my one advice that I did by accident right. And I would really advocate that is having someone else there.
I would say I thought of questions ahead of time, and I wrote, just as I do when I go to any of my other doctors for a visit, I type up the questions on the computer a couple of days ahead of time. I edit them a couple of times, and then when I go in, I give him a copy. I keep a copy for myself, and make sure that all the questions are answered before the visit is over. And there's one thing to remember, and I don't know, Chip, exactly what was going on in your case, and in Mike, you had to have bypass surgery. But for me, I couldn't have, even if TAVR had existed in 2006, I wouldn't have been eligible for it because I had the aortic root replacement that had to be done. And that is not something that TAVR does. TAVR replaces the valve. So you shouldn't think that if someone is saying to you, you're not eligible for TAVR for some reason, ask them to explain why. It could be that it's a legitimate reason why you're not.
Yeah.
There's another one too. I don't know what percent Medtronic valves are being used. I know it's probably single digits. But I do know from talking to even some Edwards people that there are some situations where the TAVR surgeon will prefer the Medtronic valve. And I don't know what makes that preferred. The vast majority I know are Edwards. But if someone says, oh, we need to be doing Medtronic, I don't know that I'd sit there and think that was a red flag. If they're saying Medtronic, there's probably a good reason why that's a better solution in that situation.
I think in the end you have to realize you're not the surgeon. The surgeon's the surgeon, and he with a wide experience that you're not privy to. So sometimes you do have to trust.
Lindsey, I know you're at the end of your questions, and we do have a couple of questions. One of them was in the chat, and it's for all four of you, actually. So some of the people on the call are visitors, and so they may be visiting with people who are about to have a TAVR. So can you think maybe about some of the questions or concerns people think back to your own experiences, gentlemen, when you were going into the TAVR, what would have kind of keep you up at night? Mark, we know yours was that they were going to give you an open heart anyway, but for the rest of you and for Lindsey, what are some questions that you get from patients before they have the procedure? And I don't know who wants to answer first. Maybe Lindsey, let you go first and then the gentleman after.
Sure, I have to think. I get a million questions. One we get here at our center is what kind of anesthesia will I be receiving? Others is what's the recovery process like? How long am I going to be out of commission for, so to speak? And
Lindsey, how long is on today's world, how long does a TAVR procedure take on average versus open heart?
the prep for the procedure takes longer than anything. We can, from start to finish, our average time is about 2 hours. But the actual putting in of the valve is really a 30 to 45 minute process. It's the start to finish and getting the lines and all the other things that it takes a good bit of time.
And how does that compare to open heart? My question really, where I'm going with this, is how long are you under general anesthesia? And as we get into our 60s and 70s and 80s, that becomes a lot more critical. And so I think one of the potential benefits of TAVR is that you're just under anesthesia, general anesthesia, a lot less, which is a good thing. But how does that, I don't know how the numbers line up.
Open heart surgery is probably about 46 hours, depending on the surgery.
Okay. And TAVR is about 2?
Yeah.
Okay.
2.5.
Yeah. It's the open heart surgery in my case was 6.5 hours, and that was because surgeon was trying to reuse my own aortic valve. He specialized in that, and it just didn't work. My heart was stopped and started 3 times, so that took the 6.5 hours. But the TAVR was just such a short experience, really. And when you come out of open heart surgery, you are wired every which way. And when you come out of TAVR, you're not. You're hooked up to stuff, but you feel a whole lot better, even immediately after TAVR.
Thanks, Mark. Lindsey, what's the minimum number of, well, not Lindsey, I get I don't know if there is an answer, but what is the minimum number of TAVRs a surgeon should have done? That's not really something I guess you can probably answer, but
So I can tell you when we started our program, my hospital is a small community hospital just outside of Houston on the west side of town. When I say small, we have about 500 beds total. And the heart surgeon that runs our TAVR program, he had been an open heart surgery surgeon, cardiovascular surgeon for over 30 years. So experience was there, but not in TAVR. Our sister hospital, the Houston Medical Center in Houston, they kind of took us under their wing, and he went down there to observe a set number of cases. He was proctored in a set number of cases downtown, and then our sister hospital gave us a physician surgeon that was like a champion that came to every case until he felt that the team was confident to be able to do the program, or run its own program. Edwards also brings in proctors for new case scenarios, like if you're doing alternate access. So not all TAVRs go through the groin. They can go through your subclavian artery. They can go through your carotid artery. And so if that's a new scenario, Edwards or Medtronic will bring in a proctor to help work you through those processes. And those people are the doctors like Chip was talking about, who've done 1 million and they can do them in their sleep. So I don't think that's I don't think there's a set number, but it's definitely more than a see one, do one, teach one.
thank you. For any of our panel, did any of you end up with a left branch bundle block after your TAVR? Robert is asking that question. No.
No,
Mike, you didn't?
no, I didn't.
Okay. Lindsey, is that common? I don't know what that is exactly.
That's where the patient would require a pacemaker after, or not left bundle. So some of our patients will come in with no bundle and they'll leave with a left bundle. That doesn't necessarily require intervention at that time, but a complete heart block is when we would insert a pacemaker.
Okay. Michael asked, did any of you have a choice as to the surgeons available at the hospital you picked for your procedure? So did you get to choose your surgeon, or you just went to the hospital and the surgeon? You did, Mike?
Yeah, they had like 3 or 4 different surgeons that could do them. So I just picked the one that my cardiologist recommended. And that worked out real well. I'm still here.
Yeah. Even at the hospital that I went to, ultimately, they did have 2 surgeons who did TAVRs, but I think I only had met one before the surgery, and they both had come from NYU actually into Brooklyn, and so I don't know how I ended up with a surgeon who did it, but I know they had 2 surgeons and 2 cardiologists in the program, and I don't know, maybe they flipped a coin to see who would get.
When I did mine, you didn't have that much to pick from. The biggest problem out here was most of the TAVR guys came out of the cath lab. They were doing stents and everything else as interventional cardiologists. But the biggest problem we had out here was facilities. My cardiologist was actually doing them. He'd done about 80, which was a fair amount at the time. But he was out of Saddleback Hospital, which had no TAVR lab. And so he was having to run up to Long Beach. So the only 2 around at the time were Long Beach and Cedars, and which I guess is technically Beverly Hills or North Hollywood or whatever it is. But and Mission Hospital, which is a big cardiac thing down where I live, they didn't have a TAVR lab. So there wasn't a lot to, it wasn't a pick and choose. You kind of had to run with what you have. From what I know, Saddleback now has a lab, Mission has a lab. I know it's far more mainstream now, and now you can probably do a lot more picking and choosing. But because of the facilities issues, at the time I did it, there just really weren't a lot of options.
And in 2018, the FDA decreased the requirements for a valve program to be able to start. And so the number of facilities that could offer TAVR was there then able to increase. So you used to have like 50 total aortic valve surgeries in 2 years to be able to start a TAVR program. And then 2018, they decreased that to 20 total aortic valve surgeries. That's the open heart aortic valve surgery before you could start a program in 2 years. So that definitely helps to expand the centers in the United States.
Julie asks for Lindsey, what artery is used now?
Typically the femoral artery. So in the groin. Does that answer that?
Yeah. And then Laura had asked, this is a little bit off topic, but is there research into mitral valves? So what's, I guess, the most recent research? That's okay if you don't, because we did not ask you to talk about mitral valves today.
So we don't have a mitral valve program here at our hospital because our mitral valve surgery volume is very low. I think since I've been in my role, we've probably done about 4. And so I know that there are other valve centers that there's different options you can use to treat a mitral valve depending on the type of disease it is. And our hospital and the medical center, they do a lot of research, a lot of different procedures that we don't necessarily do out here yet.
Yeah. Robert has a question, but Robert, why don't you email me, and I'm going to put my email address in the chat, and we'll talk about your left bundle block, and I can maybe connect you with Lindsey or someone else after if that works for you. So I'll just put my email in, but I don't see any other questions. Mike or Mark or Chip or Lindsey, is there anything you want to add before we end today? Anything we've missed or that you think is important?
I will say, Mark, you made my heart happy that the valve clinic coordinator helped you through that process, because I feel like a lot of times we might not get the recognition that that we deserve. But the people that understand what we do know how valuable we are. And I think the patients definitely speak volumes in that. Chip and Mike, did y'all have a valve clinic coordinator that kind of guided y'all along the way?
No, I didn't have one. I just talked to the surgeon and my
Okay.
cardiologist.
Lindsey, how common is it for centers now to have a TAVR coordinator or a valve coordinator? Because it seems like a very valuable position.
Yeah, I think most centers do have a valve clinic coordinator. Every center, the way they utilize their clinic coordinator may be different. So I see patients in valve clinic. I also see patients in the hospital. And so I was telling a patient that came for follow-up today, I was like, don't worry, I won't forget about you. When you come back in 10 or 20 years, like, we'll still have the same conversation. And they were like, you're going to be here in 20 years? I'm like, kind of like my job, might be here in 20 years. We'll see.
I think we actually did have one other question, and I don't know what an LBB is, but Paul asks, I have LBB, any cautions before TAVR?
So that's the left bundle branch block. The research has shown that if you have a left bundle branch block, you're at higher risk for needing a pacemaker afterwards. But that doesn't always mean that you're going to get one.
Yeah, so it's probably best to just talk to your healthcare team, right, Lindsey?
Yeah, your cardiologist can advise you on that.
Yeah. All right. Well, this has been an excellent conversation, and we're so grateful to Lindsey. She's in the middle of her valve clinic day, and she's doing this for us. So thank you, Lindsey. And Mike and Chip and Mark, we really learned a lot from your experiences. Thank you for being here. Thank you all. And afterwards, if you have any questions, just send it to info@mendedhearts.org. Thank you. Have a great afternoon.
Okay,
Thank you. You have a good one too.
thank you.
My pleasure.